Hi, everyone. Welcome. Thank you for joining us today. We're excited to have you here. My name is Lindsay Eilers, and I'm the Director for Impact Assessment and Evaluation at Enterprise Community Partners. And I'm going to cover just a couple housekeeping items before we jump into the content. This webinar is being recorded. After the webinar, we'll send an email to all registered attendees, including the PowerPoint deck, the webinar recording, and a link to the study's final report. So if you have any follow-up questions for any of today's speakers after the session, you can reply to that email that you'll receive, and we'll make sure to connect you with the right person. And then lastly, on housekeeping, we'll have time for Q&A at the end. So please type your questions into the question box within the webinar format, really at any time in the conversation, and we'll get to those questions at the end. So we're really excited that you can join us today. This conversation and the research behind it is truly years in the making. And so we're really excited to share the research findings that came out. You can see a picture of the final report here. It was released in April of this year. We'll be talking about the policy and practice recommendations that came out of this research and the realities of what it takes to do this work well and improve indoor air quality and affordable housing. Jonathan Wilson from the National Center for Healthy Housing will be providing an overview of the study, sharing about the findings and recommendations, and then we'll transition to a panel discussion that will help us consider what's next for our industry as we translate this research into action that brings ventilation and its benefits for indoor air quality into affordable housing, really with the goal of improving resident health. Our panel will be moderated by Oganaya Dotson-Newman from the JPB Foundation, and our panelists include Miranda Brazil, a healthy housing researcher, Krista Egger from Enterprise Community Partners, and James Lewis from Pinnacle Construction Group. They'll each introduce themselves a little bit more when we move into the panel discussion. And with that, I'm going to hand it off to Jonathan from the National Center for Healthy Housing so that we can dive in.
Thank you, Lindsay. As Lindsay said, this research project truly was a labor of love. We've been working on this for a number of years. We actually had a little change in the middle of it, but what we're going to be talking about now is the project that started in 2018, and it was really developed looking at the effect of greenhousing. As we were looking into our interests, we found that in talking to developers, a major portion of differential between conventional housing and green housing as certified like under the Enterprise Green Communities criteria was the ventilation requirements under these programs, specifically meeting the ASHRAE 62.2 ventilation standards. And so the study was focused on that, looking at continuous mechanical ventilation. That's what we'll be calling it instead of calling it ASHRAE. And we were interested in the effect in multifamily homes in New York and in Chicago. The study was funded by the JPB Foundation, Wells Fargo, and the Kresge Foundation. And our research partners included the Icahn School of Medicine at Mount Sinai in New York City and the University of Illinois, Chicago. The focus of the study was on multifamily affordable housing. These are units that are often eligible for low-income housing tax credits and are commonly in green programs that require certain things to go on in these properties during renovations to achieve a health and safety level that is important for our lower income families across the country. These properties have all been renovated in the last 8 years. They're all meeting the green criteria, but half of them required the ASHRAE ventilation, while the other half did not. They probably were moderate renovations since they did not require the full continuous ventilation. With our study, we found that we enrolled 160 housing units across 12 developments in the two cities. And our data collection was to visit these homes 3 times over an 8-month period to first enroll the family. And also at the first visit, we would do a visual assessment of the property. We would sometimes at the same time, sometimes within a short period of time, we would do ventilation testing to get a good baseline of what the ventilation levels were in the home. Commonly, the ventilation was being done with exhaust ventilation out of the bathroom fan. In some places, they actually also had a bathroom fan and a kitchen fan in the property. And for the homes that were in the comparison group, they didn't have continuous mechanical ventilation, but they often had a bathroom fan itself that the property residents could control. So that was the difference between the ventilation systems. One was on continuous, running all the time. The other was often controlled by the resident. So it was unclear how often they used it and for what time and what reason. In addition to the visual assessment and the ventilation testing, we did questionnaires of the residents, both of their health status as well as their use patterns of the property. So how often did they open their windows? How often did they cook meals? These were all important to understand potential levels of contaminants in the units and other potential mitigation, such as opening windows versus the ventilation. And then for our outcome measures, we did environmental sampling over a 4-day period in the main living area at each of these 3 visits to understand the levels of carbon monoxide, carbon dioxide, formaldehyde, nitrogen dioxide, and particulate matter at a range of 2.5 microns. So those are the 5 contaminants we looked at in the study. And what we found was that the dwellings in the study group, those that had the continuous mechanical ventilation, had significantly lower particulate matter and carbon dioxide. Those dwellings with continuous mechanical ventilation in the kitchen had significantly lower carbon monoxide and formaldehyde levels, while the nitrogen dioxide levels were basically the same in the study and control groups. And this was an important factor because nitrogen dioxide is a byproduct of gas stoves. And I should have mentioned up front that when we were designing this, we wanted to fully see the effects of ventilation. We required the units that were enrolled to have gas stoves because we know that between the cooking byproducts as well as the cooking process and creating particulates, we would likely see higher levels of contaminants indoor in these units. And so we were interested in seeing an effect of the ventilation in units that were likely to have higher levels of contaminants. So digging a little deeper into these study findings, as I mentioned, we found that in the study group, we had lower levels of particulate matter and carbon dioxide. Those dwellings in the study group had 21% lower levels of fine particulate matter, and these levels are associated with higher respiratory disease, respiratory exacerbation, as well as cardiovascular disease. Some might call this asthma attacks. We found that this was true in homes with tobacco smoke. We asked that the residents did not smoke during the sampling period, but we did find through testing of nicotine that there were some homes where it appeared that there was some smoking going on in these properties. And these were not all smoke-free properties, so even if they didn't smoke during the sampling period, they may have been smoking right before it. So we found that the PM levels were lower in both those units with smoking and without it, but they continued to be higher in those units with any tobacco smoke recorded over the last year. And the other finding was that we found 13% lower levels of carbon dioxide in the study group than the comparison group. And we know that higher levels of carbon dioxide are associated with reduced cognition, performance, and is also a marker of indoor air quality. We've heard a lot about this during COVID, in that units with higher carbon dioxide likely have higher levels of viruses in the air. Major observation 2 was that we found that with kitchen ventilation, we saw lower levels of carbon monoxide and formaldehyde. These are potential off-gassing things from the gas stove, as well as formaldehyde may have been coming from kitchen cabinetry that was not replaced during the renovations. And we found that with kitchen ventilation, we saw 47% lower carbon monoxide in the dwellings with the kitchen vents than without it. And I should note that we didn't have any carbon monoxide levels that were at a threat risk to the residents. These were very low levels, but still we saw a significant difference in those homes with the kitchen ventilation without. We also found that with continuous kitchen exhaust, we had 29% lower levels of formaldehyde, and this is a cancer risk as well as other respiratory factors can be associated with formaldehyde. And the final major finding that we had was that for nitrogen dioxide levels, we did not see an effect between the two groups. We had hypothesized we did. That was the basis for the power calculation for the study, and we were surprised and disappointed that we did not find that. We did not find that the units with continuous kitchen exhaust had lower NO2 as well. And so in our study findings, we came up with recommendations, and I'll go through those. We believe that people should be incorporating ASHRAE 62.2 into their codes and into their certification process for green building, and that it should be for both moderate and substantial renovations. We believe that in order to do this, we need to have our housing finance agencies increase the funding to allow for the cost of this ventilation to be installed. And we need to work with ASHRAE committee to simplify it. We heard many concerns about the challenges of implementing this. So it's not only the money, but the challenges of implementation. So there needs to be a clearer direction for engineers and the developers so they can better understand and achieve better compliance. And we need to also understand indoor air quality. It would be easier to advance these policies if we had better knowledge of what indoor air contaminants are in the property. We believe that based on our findings with NO2, that we need to replace gas stoves with electric induction stoves. The ventilation was not the solution, and if we can't find an engineering problem to solution, we should go back to the source, and the source here was the gas stoves. So we encourage people to be replacing their gas stoves with an electric. Cases we need to look to reduce or eliminate indoor contaminant sources. Mentioned smoking. Smoke-free policies are good and are really needed. So while we saw lower levels in smoking units of particulate matter with ventilation, they were still much more elevated than they were without indications of smoking. And we also need to work with our building managers and operators to improve the ventilation of the maintenance of ventilation systems. We know that we saw that in some of these units, the design specs were not being met a couple of years after installation, and it appears that they needed to be better maintained to achieve that. We also need to work with our resident services coordinators in properties to educate occupants about ventilation and how to operate it properly. So it goes hand in hand with the maintenance. So part of this is with the property owner, part of it was with the resident. And ASHRAE and others need to work on better technical assistance to help people understand the value of ventilation and also how to design and install it. Ultimately, this is about better indoor air quality, and for that we need better public education that this is a concern and that it is of value to have a better, safer indoor air quality in our homes, and that we should be doing what we can to improve that. So with that, I want to thank you and turn it back to Lindsay for our panel discussion.
Great, thank you, Jonathan. Thank you for that great overview of the study, its findings, and the recommendations. There's a lot to dive into here, so we're excited for the panel discussion. Just a reminder for everyone that you can submit questions at any time through the question section on the webinar panel on your screen. And as I mentioned earlier, the panel will be moderated by Ogunaya Dotson-Newman from the JPB Foundation. So I'm going to hand it over to Ogunaya to kick us off. And can you introduce yourself and just share a little bit about the JPB Foundation's role in the study and your perspective on the findings before we kind of dive into the rest of the panel?
Yeah, thank you, Lindsay. My name is Ogunaya Dotson-Newman. My pronouns are she and her. I'm a senior program officer here at the JPB Foundation. My portfolio focuses on environmental health. For those of you that don't know the JPB Foundation that well, we've been around for about 10 years. Our mission is to advance opportunity in the United States through transformational initiatives that empower those living in poverty, enrich and sustain our environment, and enable pioneering medical research. I sit in our environment program. We have kind of 4 big buckets of work. That is energy, green infrastructure, environmental justice, and my portfolio, environmental health. The focus of the environmental health portfolio is really to look at mitigating and addressing any type of contaminants in the indoor and outdoor environment. Part of the portfolio really focuses on creating a more innovative, diverse environmental health movement, supporting organizations that are doing work around outdoor air quality, and how we came to this work and supporting this study and being the primary funder of this study is really focusing on cleaner, greener, healthier materials that go into affordable housing. The entire environment program has a strong focus on affordable housing and on the home as part of the environment. We deeply believe, and a lot of our work is focused and really guided by the principle that housing is a human right, and that there should be healthy, clean, affordable housing for all people. So this made us excited because there isn't a ton of research out there that really talks about and really quantifies the impact that some of these green improvements or that healthy, affordable materials or that anything really in indoor environment, how it can mitigate and impact and sometimes improve health. And so we sought to do that in partnership with Enterprise and in partnership with the National Center for Healthy Housing and many of the other partners. We were really excited. It was definitely a journey that we went on in learning. And we think it's a great model for other foundations or philanthropic entities to really look into all of the things that can go into funding a study like this over the long term, and then thinking about ways to really incorporate and implement a lot of the recommendations that we're talking about and how those deeply interact with the place where we've all learned that we're spending a lot of our time and we're all learning about the real impact that housing can have on health. So that's just a little bit about JPB, about my portfolio, and about myself. And I'd like to give some of my fellow panelists a chance to introduce themselves. So maybe you all could give a brief introduction to yourselves. So Miranda, why don't you go ahead?
Yes, thank you so much. Hello, everyone. I'm very excited and honored to be here with all of you today to really discuss the important findings that we found in the studying the optimal ventilation for environmental indoor air quality, or the STOVE study as we affectionately call it. As Oganaya and Lindsay stated, I'm Miranda Brazil, and I have spent the last 10 years researching and working in healthy homes programs. Previously, I managed a childhood lead poisoning prevention program, and I have worked on research projects which investigated lead exposure pathways, looked at pesticide exposure in residential dust, and indoor air quality metrics, including the STOVE study we're talking about today. Specifically for the STOVE study, I worked as the Chicago site coordinator. And through this position, I interacted with study participants directly throughout the study process, and I conducted some of the data collection that Jonathan briefly touched on. I'm currently working as a consultant in public health and healthy homes programs. So I'm going to go ahead and pass it off to Krista.
Great, thank you both. Happy to be here as well. I'm Krista Egger. I'm a Vice President of Enterprise's Building Resilient Futures team. It's a group focused at the intersection of climate and affordable housing, and we try to take a really holistic approach to what high quality affordable housing development is, which includes looking at healthy housing practices. Enterprise Green Communities is the flagship program of my team, and Enterprise Green Communities is a national green building program for affordable housing, active for almost 20 years, and includes requirements and recommendations for mechanical ventilation. So I and my team weren't directly involved in the study, but we are now examining how to shift our practice and policies in response to the results. So happy to be here with you all today, and I'll pass it to James.
Yeah, hi, my name is James Lewis. I am the Director of Real Estate Development for Pinnacle Construction Group. I'm a licensed architect and a certified passive house consultant. Formerly was an Enterprise Rose Fellow, Architectural Rose Fellow with Heartland Housing out of Chicago for 4 years before joining Pinnacle Construction. At Heartland, we developed a good 250 units in the 4 years I was there, utilizing Enterprise Green Communities, LEED, Passive House certifications through all those programs. And currently, I work with other affordable housing developers in the Michigan area, primarily Samaritas, doing more work with the low-income housing tax credit. And so I'm very immersed with the challenges of ventilation when designing and building these kind of projects, especially as they relate to existing buildings and historic resources.
So thanks so much for introducing yourselves. Thanks so much for being here. I'm going to start out with a question that really, I think, is going to allow us to nerd out, I guess, a little bit. And nerd out in the best way, right? Because we're all very passionate, I think, about healthy, affordable housing and about taking the information from this study and being able to translate it into practice and what we do. So can you all just talk about, I guess Miranda can start us off again, what do you consider the most exciting thing about this study, given too that you had such an integral role in kind of like the day-to-day operations of it? So you probably got to see all the exciting things.
I don't know if exciting is always the right word, but yes, it was a very wonderful journey. And again, speaking for the team. We're so excited to finally be here to share this with you. But I think going back to the question, one of the things that is most meaningful or the biggest takeaway that I've seen come out of the study is one of the key things we've consistently heard from building developers, funders, even policymakers is there's this conception that there isn't enough research to always justify the added cost for mechanical ventilation. There's these hurdles, and it's kind of well established that, you know, sometimes they might be too burdensome to overcome. But this study specifically speaks to this gap in literature that everyone kind of references. This study does indicate that mechanical ventilation, and in particular continuous ventilation, significantly impacts indoor air pollutants that occupants are exposed to. Additionally, it really does speak to the importance of recognizing smoke-free building policies and just all the impact that these types of policies that the enterprise green community criteria does speak to. So those are my two key takeaways from this study that I'm very excited for.
Thanks. And Krista, did you want to also let us know?
Yeah, sure thing. And maybe to just say up front too, to clarify for people who might be joining the webinar who are like, what is continuous mechanical ventilation? What are you talking about? We're really talking about fans, fans that move air. When we're talking about mechanical ventilation, it is not just simply opening a window so you have more fresh air. It's actually turning on a fan so that you're ensuring that a certain amount of air is coming in or being exhausted from a unit at a particular time. So that's mechanical ventilation, just the use of a fan, like your kitchen range hood fan or your bath fan. When we say continuous mechanical ventilation, that just means that you actually don't have to turn that fan on because it's always running, like in the background. It may be so quiet that you don't ever notice it, or it may be very loud and always a bother to you because it is always on, but that's continuous mechanical ventilation. And so, yeah, I would +1 to what you shared, Miranda. And for me, what I would add about the most exciting thing about the study is really that it was field verified. This wasn't done in a lab. This wasn't just a simulation. It was actually field verified and looking at how these continuously running fans are affecting the contaminant levels of indoor air in homes. And so we had direct engagement with folks living in homes and had the opportunity to help optimize their indoor air quality as it related to the use of these fans. So I'm glad simply for that fact of being able to impact the lives of the folks who are participating in the study. And then secondly, you know, we've long understood that ventilation provides benefit, but now we do have statistically significantly field verified results from multifamily affordable housing that 4 of the 5 of these contaminants of indoor air quality were significantly improved. And we have ideas about why the 5th one did not. So glad to have this data to point to. And I'm glad that we were able to actually work directly with folks in the field to make this happen and to optimize their homes.
Thanks, Krista. And James?
Oh yeah, I was really excited to see this study come out. You know, I've been working with the ventilation programs for many years now, and again, as others have said, there's always been the question of is it doing anything? In my experience, after getting the funding, making it through zoning, the next most difficult thing is complying with ASHRAE 62.2. It really is a challenge. At least it's less of a challenge in new buildings, but it's a huge challenge in existing buildings. And so having this the data to support that what we're doing is worthwhile. We're all very concerned about the long-term impacts of the environment that we're building for people. So yeah, I'm very happy that this data point exists now, because there really isn't, or really wasn't, a study that captured it before.
Yeah. Thanks for bringing that up. I think that point also highlights like the challenges and opportunities of a study like this, because I know one thing that we really talked about when we were preparing for this call is all of the like next steps that we need to come out of this, and how, because when you're trying to do research, not just purely for research sake, but you're trying to also figure out ways in which to incorporate that research so that you can push the envelope and create better, cleaner, safer, greener housing for folks, that you end up having a lot of what ifs come up, and then you actually do need to do a bit more research, which can be applied and can be done to improve upon the things that you learned previously, which I know there are a lot of lessons learned during the journey of this research project. And so James, I'm actually going to start with you and thinking about the next question, because I think it touches a little bit upon what you've talked about. So building off of some of the study recommendations that Jonathan outlined, what will it take to see continuous mechanical ventilation included in more affordable housing rehabs? And thinking about this in some of the more practical ways in which you may be implementing it, while also acknowledging many of the challenges that you just brought up.
Yeah, and I also see in the chat coming in questions related to what is continuous, and Krista answered it, but I'm going to go into maybe a more detailed version of it. So, because it's very replicable from building to building, what you're really trying to do is take out a certain amount of air from the bathroom and kitchen area and replace it with the same amount of air in the bedroom or living space, and it just constantly moves. And so in our world, we usually use CFM, or cubic feet per minute of air moved. So just kind of as a baseline standard, we're trying to take out about 50 CFM, cubic feet per minute of air out of the bathroom at any given point. And we're also resupplying into the bedroom and living space that same 50 cubic CFM, and it's just on all the time. Right, so you're changing the amount of air in the unit almost, not quite once every hour, but half a change every hour. So the entire volume of the air in that unit is exhausted, right, out the building, every 2 hours. So that's a very simple way of talking about it. And now you're thinking, wow, that's a lot of air that's going out of the building, and that's all heated air or cooled air, right? It's a lot of waste. Right, so what we use is known as an the simple way of putting it is an energy recovery ventilator that captures about 70% of that heat or cool air, or the energy stored in it, and without cross-contaminating on its way out. There's products that do this for you. It captures that heat and puts it into the incoming air. So the challenge is then, well, do I buy one of these things for every single unit? Do I buy one of these things for every single floor and then have a large ducting system to get it to and from each unit? Or do I buy one for the whole building, right, and have even more ducting to get it to and from every unit? And each of those solutions comes with a different design challenge with how you create the ducts and don't lose the static pressure and things like that, where you can get big building systems that are maybe a little bit cheaper up front but harder to maintain, or you can do individual ones which are a little more expensive up front but easier to maintain, or if one goes down, you're not taking off the whole building. But you really got to think about it as, I have all of this duct work, and where does it go? How do I get it from an outside air source to the unit and back again, but not using the same ducts? And if you're in an existing building where you didn't maybe have the head height to put all those ducts in there, usually they go in the hallway. Where do they go? You're either going vertically through fire-rated floor assemblies, or you're going out the outside wall. And if you're in a historic building, you can't go out the outside wall, right? It's not allowed by the National Park Service. So these are the challenges that we run into. And then if the holes coming into the units are bigger than a certain size, then you have to put in fire dampers and smoke detector or smoke dampers and tie it into a fire alarm system. So that there's a threshold that you want to keep the ducts going into units at a certain size. So you can see why this is one of the bigger challenges of what we do in the industry.
Yeah, thank you. I think that is very helpful at outlining the very technical aspects, and kind of I feel like if I were an architect, you would have given me the Cliff's Notes of the how-to guide for different types of properties. And so I was just wondering if Miranda or Krista had anything to add in thinking about, the recommendations that Jonathan outlined, And there was a question too that someone asked in relationship to the literature about indoor air quality and ventilation and how it relates to communities of color. And so I was hoping that maybe Miranda or Krista could incorporate that into your answer, because it feels like it overlaps kind of with the recommendations of this study, but also overlaps with some of the intentions that I think were made going into this study when it had a slightly different name than the stove study. So if either one of you wanted to answer that, that would be great.
I can kick us off. Yeah, great question. So yes, to your larger, bigger picture question there, Uganaya, when we are looking at communities of color, when we are looking at folks with lower incomes, we are typically looking at housing environments which have more exposure to environmental toxins and less ability to do anything about it, less ability to improve it. And so one of the thoughts of looking at this study is, now that we know through this study that installing these particular types of mechanical ventilation systems can improve the contaminants in the air in living spaces. And we have the evidence base that shows that those reductions of contaminants in the indoor space lead to reduction in deaths and health-related inequities in homes. I think we're seeing the real value of being able to apply these types of systems, particularly for communities of color and for communities with lower incomes, so that we're able to take some direct action to reverse some of these health inequities that exist. It's not the only thing that needs to be done, but it's now one verified arrow in our toolkit that we can implement to make a real difference. So, you know, what Jonathan was talking about different recommendations that we're spurring from the study, about what James was lifting up about different challenges and context in which those must be implemented. I think we do recognize that installing ventilation in rehabs is inherently difficult, because those buildings that are being rehabbed, when they were originally built, if they did not include ventilation systems, the space constraints are just are really challenging to work around to add a new mechanical system. So I do think that for folks who are funding the development, or particularly the rehab of affordable housing, to provide specific call outs for funding and to pair it with technical assistance to determine appropriate mechanical designs to install ventilation systems and to pay for them, would be a real game changer in helping to reverse some of these health inequities, particularly in affordable housing, through this particular strategy.
Yeah, thank you. And then also more, I guess, specifically Miranda, one of the recommendations directly related to resident education. So I just was wondering if you could talk about a little more about the significance of this role and the role of education in achieving overall air quality and health impacts that we all hope to see. So I'll leave it there. I have a follow-up, but I want to keep that question short, and I'll add my follow-up at the end, because maybe you all will have something to respond to.
Thank you so much. Yes, and I would just like to reiterate with the other panelists that I think one of the key takeaways from this study is really that the study does support that, you know, ASHRAE and this continuous mechanical ventilation should be implemented by more renovation projects. So really speaking to the equity and the access issue that I think was being raised by the intent of that question. And so, you know, kind of building on this, I would say that education is welcomed and wanted by the occupants that live in these homes. Specifically, I can speak to some of the study participants and interactions that I had with them. They often expressed how grateful they were for the stove study, and they said that the simple fact that building managers were willing to partner with us as researchers showed that the administration really valued their health and the health of their family. And so individually and as a whole, collectively, participants were engaged and curious at every step of the study. They were often asking questions about the sampling process and how to interpret the results. And so I think one of the things that was challenging to explain in my position is that although there are limits for outdoor pollutants, largely these limits don't exist for indoor pollutants. And so for them, when they would get their results and want to have something to compare it to, trying to understand that these are reference values. And in general, there is that understanding that high levels of air pollution is not a good thing, and that they have been linked to negative health outcomes. And so there really is an importance of using the strategies to lower exposures overall. And in talking with the participants, they reported that they were unaware of what their ventilation was within their homes. So they knew in general if they had some type of stove hood fan, but they couldn't really describe if it recirculated or just put air back into their home, or if it actually exhausted to the outdoors. And the participants that I personally interacted with really didn't have any knowledge of what the ventilation system was in their bathroom. An anecdote is I remember several of them told me that there was a light switch in their bathroom that didn't work or didn't do anything. And as Krista mentioned earlier, a lot of times exhaust fans are often designed to be almost so silent you can't hear them. So unless you know it's there, it's easy to overlook. And so while they are continuously exhausting that air from the bathroom or from the kitchen, depending on the situation, as Jonathan described earlier, they often have what they call a boost mode. So that switch that doesn't do anything in the bathroom actually turns it to a higher ventilation, so that if someone's taking a bath or a shower, or if they're cooking over the stove, it can actually pull out more air to increase the ventilation. And so builders and developers who make the investment in increasing the ventilation in the home should make sure that residents are fully aware of the benefits. So the ones that we've been highlighting throughout this call today is really seeing this decrease in air pollutants within the homes themselves, and how residents can maximize that effect through using their ventilation properly. And most of the developers I interacted with stated that when residents do move into a new home, there's some type of orientation that they provide. So this is the perfect time to explain the importance of the ventilation in their home, how it could impact their health, and how to maximize the benefits, and how to monitor the maintenance or the function. As we've mentioned, we do realize that when homes are designed, a lot of times a few years out, they might not meet the same design specifications that were intended. And actually, we were able to identify some ventilation components that were not operating as intended. And we worked with both the resident and the building maintenance to restore the function. So I guess my one key takeaway is overall education for residents is extremely important, as they're not passive bystanders, but that they really are active collaborators in this endeavor.
Thanks for that. And some of what you also said, which also I think picks up on what each of us are talking about, is that this really is a collaborative exercise. Whether you're doing the research, whether you're talking about the maintenance, whether you're talking about the building, the importance of having a real kind of like collaboration of voices from people who are going to be living in the housing, to people who are maintaining and doing like the day-to-day maintenance, to the folks who are designing and thinking about this, to the advocates. Without all of those voices kind of coming together, seems like you can have either solutions or sometimes recommendations that don't necessarily reflect the total impact, and can sometimes create, I guess, more challenges than were anticipated. And I think that's something that I really appreciated about being a program officer who, fortunately or unfortunately, gets to be the person who asks sometimes random questions and gets to, I guess, like suffer adjacently to the folks who are trying to implement this, is that, really understanding how challenging and interesting some of this type of work can be, and the real importance for, I guess, in some ways, philanthropy to partner with government entities and other folks to be able to fund this type of work over the long term is like really deeply important. I wanted to transition us into kind of taking in some questions that folks have been asking, because there's quite a few questions that are kind of like there weren't clear trends. So before I kind of jump into the popcorn style, I just wanted to make sure that James or Krista or Miranda, if you all got a chance to really like cover everything that you thought you wanted to cover, or if I needed to give you a little more time to do that before I go into some of the questions that folks have been asking in the internet world.
I think I'd like to also point out that there are real challenges around the maintenance of these systems, and in how buildings are staffed and the realities of staffing, maintenance technicians and property managers, that there's high turnover in these properties. Being a property manager in an affordable housing or any apartment building is a very, very challenging job, and the turnover rate's pretty high. And so there's this constant training that needs to happen within an organization for both of those positions in order for these systems to be maintained, because they're mostly covered up and you don't see them, and they're not common to every building. So it's not like something, if I'm going from one building to the next, they're not going to be in every single one of them. The way they're designed, they tend to be fairly unique to each building, despite the fact that what you're trying to do is fairly similar. And so it's hard to expend the amount of resources to keep up that level of education for your staff to make sure that they do operate properly. And then on the resident side, when you have continuous ventilation, it's often air coming out of a duct that is not warm, right? And it's always coming out, and they don't know what it is if they haven't been educated properly, which happens a lot. And they then often will duct tape, a piece of cardboard over it, right? Because they don't want that cold air blowing on them, and they don't know why it's happening. So that's just something I've noticed, going into a lot of units and talking to people over time, and talking to the staff at Heartland. So yeah, I would highlight that point that designing is very difficult, but implementing and making sure it's doing what you are hoping it's intended to do is also very difficult.
Okay, thanks. So I'm going to jump into the questions. It's going to be all over the place. I'm just letting you know. One of the first questions that someone had is, are there any indications as to where the formaldehyde that was picked up in the readings came from? And if no one knows, then.
So I can speak a little bit to that. It was kind of answered a little bit in the chat, but formaldehyde is commonly found in a lot of occupant use materials. So it could be through cleaning chemicals, it could be through some of the building materials themselves. I know that as part of the green communities criteria, that there is a standard that they should be low emitting pollutants or to reduce the off-gassing, but it does still happen in some of those as well. And if a resident or an occupant is bringing in furniture pieces that don't necessarily meet those same criteria, those same standards, so it might not be that the traditional cabinets or flooring in this scenario, but it could be furniture as such as a couch or upholstery or some type of other chemical that they brought in for any other use products.
Okay, thanks. Are there any strategies for ensuring that as their national push for cooktop conversion is happening, that there is occupant education, I guess, going along with it? And I don't know, you all know.
I can take a stab at that. I mean, yeah, I think we are seeing a growing wave of, in some cases, policies and regulations to switch to or to install electric or electric induction stoves rather than gas, and completely agree that that need for education doesn't just go away now that you've switched out the type of equipment. You just simply need a different type of education. And I am not aware of a complementary education push that's parallel to that policy push. And so I think it is inherent upon all of us right now to ensure that that can happen. And happy to have more of a follow-up conversation about that after the session.
Okay.
I was going to say, I would just add to that a little bit. I know areas, it's been a local movement. As Krista had mentioned, there are policies now that are going into place, specifically in some cities in California, in which new homes are being completely electrified, so kind of reducing that gas appliance emission. But counter to that, I do know there's areas in the US in which natural gas industry is pushing back, and so they've actually, I believe at some places in Texas, have banned such regulations. So again, I think there is a big education and policy piece here that needs to be balanced as we look at why these recommendations are being made is because they are significant contributors to indoor air pollutants. But I completely agree that there is a big policy push in this field for the electrification and the reduction of gas appliances in homes.
Okay, thanks. And I may have missed this, but I don't think I did. Does the introduction of these types of systems in the rehab process impact tenant utility costs?
Yes, absolutely. You know, it's not a true study because I've never published it, but Heartland Housing had 1,200 units across its portfolio in Chicago and Wisconsin. You could notice a trend even in new construction units between the two jurisdictions, where Chicago had a higher required ventilation rate. And the utilities were certainly higher in our Chicago buildings than they were in our non-Chicago buildings. So ventilation is certainly playing a role in those higher utility costs. Now, one has to understand that in the low-income housing tax credit program, those utility costs are not being passed on to the residents directly. Their rent is lower to compensate for those higher utility costs. However, indirectly, the developer has to come up with more capital, and therefore you build less units in response to that added cost, if that makes any sense, right? You take a recurring debt and turn it into a capital expense.
Okay, thanks. I just want to make a note for folks that are in the audience. It feels odd because we can't see you, but we know that we're not going to get to all of the questions, and we know that some of the questions are more technical in nature. And so our hope is that you can either follow up with folks by replying, I guess, by sending an email to the team, and we'll be able to address them, or hopefully there'll be some other way for us to answer these. So, because there are quite a few here, I know we're not going to get to all of them, but I just wanted to mention that for everyone that continues to bring in questions. And so then, does this also apply, because I know this came up in the study, and I know it's come up in another study that JPB has funded, but can you all talk about how this type of work also applies to single family homes in addition to multifamily buildings?
I can start and say that I think the most difficult application of continuous mechanical ventilation is existing multifamily buildings because of the reasons that we've already talked about. And the simplest installation scenario would be for new construction, single family, because you have so many more outside walls to go through with your duct terminations. You just have so many more options about where to put the equipment. The impacts, we would suppose, would be just as beneficial. So while yes, this study was looking at the most difficult use case, we would still equally promote the installation of continuous mechanical ventilation, even in single family.
Okay, thanks. And then the last, I guess, question that we'll have that I'll ask you all before we hand it over to Lindsay to do the closing is just, are there any materials or pieces of information or guides that any of you would kind of point folks to if they had more questions about this? I mean, obviously, in addition to the study, which they're going to get the link at the end of this. But if there are any materials or resources that you feel like really provide helpful information in relationship to mechanical ventilation, kind of like clean indoor air quality, and all the things that were kind of covered. I don't know if you have any go-to resources, but I'm sure that people want to know how they can tap into the brilliance that you all have.
I'll throw two out there, and I'm sure Miranda and James will have more. One is on the more construction side of things, and we can include a link to this in the follow-up email, but in California, in regards to compliance with their building code, Title 24, there have been some great resources put together around what are the steps to design a mechanical ventilation system that has these types of impacts. So that's one thing I would recommend that people use. And then the other resource I would recommend is actually a mantra that we came up with near the conclusion of the study, which is turn on, turn up, open up. So for folks who have or don't have mechanical ventilation where you live, turn on your fan if you've got a switch for it. Turn up your fan if you've got a switch for that, or open up your windows if you don't have a fan at all, so you can still experience the benefit of some ventilation. So turn on, turn up, open up, something I would want to leave you with.
Thanks. Miranda or James?
I would just reiterate what Krista said. I think it really speaks to the heart of what we boil down our entire report to, of what we want people to take away with how they can impact their ventilation and how they can kind of take ownership and really make meaningful change as far as this education piece. And it really is to use the ventilation systems and to advocate for policy workers and for funding sources to make sure that, you know, regardless of where you are in life, that you have the ability to really control your indoor air quality exposures. So those are, I would just reiterate our mantra of turn on, turn up, and open up.
Okay. And James, the almost last word.
I like a lot of what people in the passive house industry are doing around ventilation, and so if you want to get into some of the more weedy, how do you solve this particular challenge type things, going on the passive house website, they have some resources in this category, and also the Building Science Institute publishes a bunch of research papers on how to put this stuff together. This would be helpful.
Okay, so thanks to all of you for sharing with us and for all the work that you've done in this area. Lindsay, I'm going to pass it on to you. I think you're going to appear somewhere, and we appreciate all of you for joining us.
Thank you all so much. That was a really engaging and informative session, and thank you all for joining us today. And I think we could have spent a couple more hours digging into all of the great questions that came in. We're really pleased to have this conversation. We view this session not as marking an end to the research, but really as the beginning of moving deeper into solutions that can bring the benefits of continuous mechanical ventilation into more homes. So we're really excited to be at this point of translating research into action. The PowerPoint deck will be shared, as well as the webinar recording and the link to the study's final report. We'll also try to make sure that we can answer some of the additional questions that came in that we didn't have time to address. And so you, as registered attendees, will be getting an email from Enterprise Green Communities with all of those resources. If you have additional questions for any of the panelists, please just reply to that email, and we'll make sure that it gets to the right person. That's probably the easiest way for you to get a hold of anyone here if you're not already connected to anyone on the team. And so we look forward to continuing to engage on this moving forward. And thank you so much again for joining, for all of our panelists, for your great perspective that you brought here today. So with that, we're going to close out and have a great rest of your day. Thank you all.